Okay, thank you, Jyoti, for joining us today in this podcast called Brain in You. I know you are an expert in this field. You counsel a lot of parents, you have a lot of learning sheets. You are teaching many more parents, many more children how to do things better. But today I want to hear from you, more about your background, your child, and what do you do. And I have listed a couple of questions that I'm very interested in asking you.
Sure, sure. So, yeah, my name is Dr. Jyoti. So, I am a mother to an autistic child. He's 4.5. So, well, it's very confusing. If you will meet Ivan, you will not understand that he's autistic. And that is the biggest problem with mild autistic kids diagnosis. Because in our Indian culture, when you ask somebody, like I also ask my friends, do you feel Ivan is autistic? No, he's normal. ऐसे ही तो है, only speech delay is there. Rest he looks very normal. But as a mother, I know there is some issues, certain issues. I know his teacher knows,
Hmm.
but what we do, we have identified his issues. So we work on it together along with his school teachers and his school staff.
Hmm. Hmm.
So I feel the main problem, if level of autism, as we all know, there are different level of autism. But with if I talk about my son and problems with the mild autistic kids is diagnosis. So every parent, in the moment they are like, child is out, it's in the world, they have to always make sure they are checking the milestones.
Hmm.
So for Ivan also, we were doing always that. And 2 years onward, we see the features like, yes, he is showing the red flags for autism. So I think that's very important. So I come up with a background of early childhood education where I have worked for 2 years in Bright Horizon Daycare, where we were serving Goldman Sachs. So there they used to train us specifically with the issues like a child is not eating food, or a child is very, angry, anxious, or certain behavioral issues are there. They used to train us like how we can manage and handle that. Somehow that experience helped me to, work on Ivan in a much better and experienced way. So currently, I am running my Instagram page, and along with that, I have 3 WhatsApp parenting groups where I try to help all the parents with their queries because autism is a wide spectrum. So every child has, different symptoms, different challenges. So as a parent, we need to understand a child, what are his needs, and work according to that. So in that group, we keep on sharing information, resources like worksheets, whatever is needed for, specifically for autistic kids. So we keep on sharing information, we do workshops, we try to help them out. So that's what I'm doing. Along with that, I run my own edtech company called Geekbag. So where we provide online music classes. So it's all the time busy job along with the autistic child who is 4.5 years now. So that was all
That,
about me.
yeah, that's amazing. That's a lot that you do. And I feel it's actually very serendipitous that you already had experience in child developmental center, which is helping you with your son now.
Yes, yes,
Learnings,
definitely. It's
yeah, yeah,
something.
yeah, yeah. Okay. So my question is now when your son was diagnosed and you said he's mild autistic, in your experience so far, he's 4.5 years old. What is it
Yeah.
that one best decision that you took that
Mhm.
you think helped him?
Yeah. So I will tell best decision was stopping his daycare.
Oh,
I don't know, many people will not agree to me. Well,
mm,
he was going to a very good daycare and we were
mm,
definitely paying very high fee for that. So what happened around 2 years, we started, he was showing the red flags, speech delay was there, no name response. So common symptoms. I think most of the autistic kids have this. Then everybody was like, okay, because he was a preemie child. So we believe that can also be the factor. He was born only at 1 kg and he was in NICU for a month. So we were mentally prepared that there will be some delay in his overall development, maybe physical, motor, or something else. But we were not expecting autism. So it was not a shock for us, but definitely we were making ourselves prepared. Okay, how we, make his life better and
mm,
make him to,
Mm,
go through it in a proper way. So what
mm,
we did at 2 years, there was no diagnosis for him, but we noticed symptoms. Everybody suggested us put him in daycare. So
mm,
there will be social gathering. That is the
mm,
standard every
mm,
advice everyone gets. So we
mm,
also thought, okay, let's put him in daycare. So he was going to daycare and he was spending almost 6 to 7 hours there. As I am a working mother. But slowly, after 6 months, I started, there was no progress in his development. Speech, there was no speech, and other things, symptoms were also like, you can make it out. He's different than other kids. And he was very hyper. And when I used to take him to park or to any mall, it was like horrible to control him. He will
mm,
simply run without listening
mm,
what mama is saying is they and they don't have fear for danger. So he will
mm,
simply run. So I stopped taking him outside. Then after 6 months, I had discussion with the principal. I told her I can feel these things are lacking. So they assured me, no, no, he is not autistic. They did some assessment, OT they did there. They said, no, as per our OT, he is fine, just speech delay is there. But as a mother, you are never satisfied. You feel there is some problem in your child. Then we went to the CTC department in Trivandrum and we did his proper diagnosis. So they also didn't mention us the term autism. I think they are educated people and they don't like to label a child. So that
okay.
was that professor's word. They said he's too young to label him autistic, and moreover, it's only 1 day assessment, so we cannot assess a child based on 1 day, and that too at too young. He was at that time only three, less than three.
Mm,
So, but they did the assessment and they said, looks like mild autistic. So, just you have to do early intervention.
ah,
We said, okay. Then as you know, government hospitals are always full. So, we didn't got any slots there. And by the way, I didn't like the approach also, the way they were
mm,
doing the therapies and all, because I come from that early intervention, early
mm,
childhood background. So I know how to deal with kids. So I was not happy the way they were approaching. Then we contacted few local speech therapists and OT. They were good. Both of them were very good. And I started my own home programs. And after 6 months, my speech therapist and OT, 4 months we did. She's like, you are doing more than us. So it's better you continue your home program. We will
mm,
just guide you. So
mm,
that process, we are still, that process is going on. And I just,
yeah.
we find many good people, psychologists online, or sometimes somebody will refer us, this is a good person and genuine person. So we approach them also. We book the counseling session, both me and my husband. But whatever we did at home. And there are a drastic changes in our
Yeah.
child. So,
Mm,
yeah. So he's
that's
now
true.
4 and a half.
Yeah. So, what I hear from very renowned therapists and senior therapists is nobody can be a better therapist than a parent. They say
Yeah,
it
of course.
themselves. And
Yes. Yes.
we now, we are in touch with almost 4 lakh parents. But I still remember tons of those mothers, especially, who have worked
Mhm.
directly on their child for 6 months,
Yes.
for a year, and I've seen the progress.
Yes.
And
That's
so
true.
I think the reason why Ayurved even launched these home parent-led therapies, small
Mhm.
10-minute
Yes.
therapies, was actually because of this. That if you
Yes.
can't go to a therapy center, nobody can
Yes.
be a
Yes.
better therapist than you. You should do it at
Yes.
home.
Yes.
So
Yes.
I think,
That's
yeah,
good.
that's
Yeah,
true. That's true.
we follow.
So
Yeah.
in this process, Jyoti, when you were doing the therapies, which at this age, let's say a child is 4.5 years old,
Mhm.
in this journey, which therapy would you point out has been most useful for him, or do you think can be generally useful for children?
So they have to follow the routine. First, most importantly, is follow a routine and understand your child. As they say, autism is a spectrum. I cannot ask another autistic mother that what you are doing. It can be different for her child, and it will be different for my child, because their sensory needs are different, their everything that's why it is called
Okay.
spectrum. So you have to first identify needs of your child, your emotional regulation of the child.
Mm,
That's very important, to understand emotion of the child. And as a mother, I think you can definitely figure it out what is
mm,
going in your child's brain.
mm,
That's everybody asks me, like, how you plan Ivan's everything, and like, I know he's my son, he's my baby. I know what is
mm,
going on in his brain, what will be his next action.
Hmm.
Because see, kids are replica of mother or parents or grandparents. That's the
Hmm.
genes, right?
Hmm.
How we behave, they will behave the same way. I don't think they
Hmm.
are, they are doing
Hmm.
anything differently other than parents or grandparents or,
Hmm.
our first relation, masis or uncles. So we all know our behaviors. How is
Hmm.
grandfather? How is grandmother? So just we need to work on it.
Hmm.
That's what we
Okay.
do. and
So,
and
uh,
association with grandparents is of great help, because sometimes maybe like his father was doing the same kind of thing when he was a child. They can guide us, yeah, this was he was doing and this is what I did. So that helped with Ivan also.
no, that's good. So you said routine emotional regulation and maybe connecting more with your elders in the family to
Yes,
say,
yes,
how
yes,
were we when we were kids? Yeah, okay.
yes,
Okay,
yes.
makes sense.
It
So
helps, yeah.
you mentioned a lot of parents come to you today for help and guidance. So how do you counsel the parents who come to you today?
So I asked them first, how is your home environment? Because if you can talk to 10 therapists, you can talk to 10 doctors, but if your home environment is not good, nobody can help you.
Mm,
Because see, therapist, you can go to a therapist weekly 2 or 3 times. More
yeah,
than that, no therapist will recommend you to come also. Right. So
yeah.
that means rest of the things you have to do at home. If your home
Mm,
environment is not good, so first, my always first question to them is, how is your home environment? So they come up with the questions like,
yeah.
my son is hitting his head, or they're not listening when I'm calling them. So,
Mm,
so I tell them what you do, what is your home environment, like
mm,
how you talk to your child. That matters. How you talk to your child. What are your face expressions? Are you making the eye contact? Are you shouting, screaming, or getting frustrated? Because as a autistic parent, we sometimes do get frustrated.
mm,
So I am a very strong person. I am very positive with this. But yeah, sometimes I also have my own fair
yeah.
sharing of sorrow, and about,
Mm,
I get worried
mm,
about his future also.
mm,
Although he's
mm,
so mild autistic, but even then, as a parent, we also get
mm,
concerned what will
mm,
happen in
mm.
future. So that is
Yeah.
my list of
Okay.
question to all the
Yeah.
parents.
Makes sense.
Yeah,
Makes
yeah.
sense.
I don't
So
ask
what?
them which
Mm,
therapist you are going. I know
mm,
therapist is educated, they will
mm,
do best. But what
mm.
you are doing it.
Yeah. Absolutely makes sense. Yeah.
Yeah.
So what can the parent do? What is it that they can do at home? Any particular game
Yeah.
or activity or something that what comes to your mind first? What do you say that once they have fixed a home environment, this is what you should start doing?
So they have to first list down the challenges. What are the
Okay.
challenges? The sensory. They have to categorize it. Sensory issues and other issues. They have to
Mm,
all put it in like 2, 3 categories. These are the
mm,
issues, and they
mm,
have to list it down. Okay, in
mm,
sensory issue, my
mm,
child is jumping a lot, very
mm,
hyperactive. How I
mm,
will make a balance between hyperactivity and hypoactivity,
mm,
because some kids, all autistic kids are not hyperactive, some are hypo also, who just want to sit
mm,
in one place and don't do anything. So
mm,
they need to understand and balance both the things. Because
mm,
if we are giving, like some parents, one of the parents, she told me my child is very hyperactive even after
mm,
going to OT also, because they were taking OT every day.
mm,
So it was like hyper stimulation for the child.
mm.
So then I told her, you have to balance it. You cannot do something like that. So they have to make
Okay.
sure they are making it a balance of both the things. Then they are keep doing some calming activities. They need to, like, if I tell some calming activities, the best is reading books. That is
Okay.
definitely immediate calming, especially
Mm,
that works for my son. Then
okay.
there are a lot of other water play. Water play is something also very calming for kids.
Mm,
They can do some rawa play,
mm,
right? So these are very calming activity for kids. And more
mm,
specifically, we can do, meditation, put the
mm,
mantras in the background. So
mm.
all these things works for Ivan also, and I suggest to other parents also, try what works
Yeah.
for your child.
Yeah.
They have
Yeah.
to kind of figure it out, just not
Mm,
copy paste what I
mm.
told. You have to just
Yeah. Yeah.
list
Yeah.
30 things, 30 activities, and out of 30, maybe 5 activities will work for your child.
Got
So
it.
that's what I suggest to them.
Okay. And when you speak to them, what is it that you've realized in this whole in your experience of speaking to them that what is it that stands out that they always do wrong?
Done.
Mm,
Anxiety, they
mm,
are very anxious, they feel
mm,
it's a disease. ऐसे बहुत सारे,
Yeah.
most of the parents think it's a disease
Hmm.
and only doctor or therapist will cure that. So
Hmm.
because I know even when I go down with Ivan in the park, there are some bully kids. They make
Hmm.
fun of him because he's not able to talk. But
Hmm.
it's my reaction how I react. I know my son
Hmm.
is smart. So I know how is my son. I don't need their perspective,
Validation.
what they think about
Hmm.
Ivan, right?
Hmm. Hmm.
So that is the biggest problem with all the parents and
Yeah.
masking. They want to
Asking.
mask the autism
Very true.
with
Hmm.
normal kids. नहीं ऐसा नहीं है. They will keep on pushing. No, normal kids also do it.
Hmm.
In fact,
Hmm.
my own sister, she will, I know out of love, she will say, my son is also like that. I said, I know kids are like that, but as a mother, I can differentiate between an autistic child and a normal child. It's normal for a kid to do the tantrums in the mall, but their tantrum and autistic kids' tantrum is
Well done.
different. You
Yeah.
can
Yeah. Yeah.
make it out.
Yeah.
Yeah.
And have you come
So
across any myth that most of these people have carried and that you want to break?
बहुत सारे. They
Hmm.
think like I mentioned we have a group of autistic parents.
Hmm.
So they will say autism can be due to this vaccination. सबसे बड़ा
Hmm.
myth.
Hmm.
So, and then STEM therapy, whatever it is going on, that
Hmm.
STEM therapy can help with the autism. So,
Hmm.
I don't know about this, it's a myth or not, but as a parent, I will never go for such kind of approaches for my son.
Hmm.
And vaccination. So we had a
Hmm.
huge argument. I shared all the good reference paper that
Hmm.
see what the research people are saying that it doesn't happen with vaccination, but they
Hmm.
don't want to argue. They're like, all these researches are fake. They are funded. So
Hmm.
I said, okay, you want to, accept that vaccination caused autism in your child? Okay, go ahead. We
Hmm.
cannot say anything in that.
Hmm.
So
Hmm.
yeah,
True.
this
Fair
is
enough.
the main I can
Okay.
see. Yeah.
So, Jyoti, one of the last few questions. Now, since you have been on this journey for mostly 1.5, 2 years now, what do you miss the most? I mean, something that could have made the journey smoother, easier, better for you, maybe better
Mhm.
for your mental health. What would that be?
Yeah. I feel maybe little early diagnosis we
Okay.
diagnosed him at 3. Maybe we could have started working at the age of 2.
Mm,
So, so I was like, I come from early childhood background. So
mm,
till 2 years during COVID, he was a COVID baby. We were doing all the things. I was having his own full nursery. He was doing all the activities. But then we started traveling. So we were like traveling 4 5 months, and he got cold, severe cold, and due to that cold, that all his entire development got delayed. He was not putting on weight and height and especially speech. So those gap of 5 6 months was terrible, and that delayed all his developmental progress. And moreover, when kids get cold, there is no cure for cold, so
mm,
it will eventually go with time. So we are left with no option other than to give him cocoa melon because that
mm.
was so, it is so stimulating for
Yeah,
kids.
yeah, yeah,
If
yeah.
we have to give him, nebulizer, how I will make him sit every day in
Mm,
nebulizer. He used to get irritated and he was only 2.5. We have to give cocoa melon. So
mm,
that space of 5 to 6 months was terrible for him also and for us also.
mm.
And then slowly we try to change everything, and it then only it worked for us.
Yeah,
So that
yeah.
is my mother's guilt, or we feel like if we could have started things little more earlier.
Mm,
Till now maybe we never know, there were some good results, more good results
mm, mm.
we could
What
have
about
seen.
your mental health as a mother? Did you ever find this journey lonely? Did you have enough community with you to speak to?
Luckily my family, both my families, very supportive, especially his grandparents. So when he was diagnosed, I was with them, staying with them for almost 7 months, and they were super supportive. And you will not believe, when we did a zero screen policy at home, his grandparents will also not watch TV. Can you imagine any grandparent doing that sacrifice? Hats off
Mm,
to them. And my son, although he's autistic, but he has his own, strengths. He is very good in eating. He eats only healthy food. If we take him out also, because I am a person who believes you should eat everything, whether it is a junk food, but sometimes, not always. Monday to Friday, Saturday, he follows his routine. Then sometimes if you're going out for dinner, I tell him, Ivan, you can eat whatever is there, pizza, or he will not eat. He will taste it and he doesn't like the taste. So all
Mm,
that is again because of his grandparents, because he was in that such environment where they are eating only on healthy,
mm,
on dining table, and on fixed timings. They have fixed timing for their breakfast, lunch, and dinner. So, that sport all, and my husband, he is super sportive. He will make
okay.
sure that, recently he was going to school for 3.5 hours. So he can see that I am little stressed because it was becoming tough to manage job, my work, and Ivan, and so many things. And then he didn't say to anything to me. He said, we are going to put him to daycare. I was like not prepared for that. I was thinking for a year, I want him to stay at least closer to me. No, he will go to daycare. Let him go to daycare for 6 hours. So, no, he's going almost 6 hours daycare plus school.
Okay.
So, no, I have enough time.
Mm,
So,
mm,
he
mm,
makes sure he talks to me. Are you okay? How is your? Because as a mother, we take more stress.
mm.
So, I luckily I got very supportive parents from my both
Nice.
sides. My parents also and his parents also.
Mm,
Very sportive, very positive. Yeah.
okay.
So,
And did you have a community of similar parents, mothers that you could speak to, or are you still in touch with them? Was that easy for you to find? Because that is something we hear from our parents that they don't have.
oh, strange. No, we have. I didn't find any difficulty because we are four sisters, and my elder sister is already working in one of the best daycares in Bangalore. She is working in as a manager, some director, I guess. Yeah. So she comes with this background. She is PhD in child development. So she
Okay.
was the first who diagnosed Ivan.
Okay. Okay.
When first time we met
Oh,
her,
that's
she's like,
that's very good. So you
yes,
basically have support at home itself,
yes.
because a
And
lot
then
of parents we speak to miss
yes,
that.
then
They
he only connected me to other parents, and then
understood.
slowly we
Yeah.
had.
Yeah. Yeah. So I was mentioning to you that this is exactly why we are trying to make that app so that parents can connect to
Mm,
more parents and just talk.
yes,
Nothing
yes,
else, just rant, just talk. Okay, yeah, I think this is especially important for the mental health of that parent who's going
yes,
through this whole day. Yeah,
yes.
yeah,
That's
yeah.
true. And most importantly is we should not ignore the symptoms.
Mm,
Generally, in India, I don't know about other countries, but in India, when you tell somebody, oh, our child is showing, little speech delay, or no, there is less eye contact, they will say, अरे नहीं नहीं कोई बात नहीं वो तो हो जाता है ये हो जाता है cover up हो जाता है. So we start waiting. That waiting window is killing the
mm,
child's development, because if whatever we have to do before 7, we have to make sure we are providing the early intervention.
mm, mm,
So that's very
mm,
important. So my
mm,
aim is that your child is absolutely normal, ठीक है, very
mm,
good, but you have to be attentive. You have to
right.
follow check the milestones.
Mm, mm, mm,
Small here and there milestone, 1 month, 2 month, three, it's fine. But if it is delaying more, you have to start working on it. That's it. And there is no harm working on it.
mm, mm. Okay, I have one last question, and this is my favorite subject, Jyoti, and this is about nutrition. You mentioned nutrition. You mentioned that your son eats a lot of healthy food. So
Yeah.
how important, according to you, is very specific nutrition, specific brain nutrition in this journey?
It's very important, very, very important. I think some people come to me and they ask, we are looking for the best daycare for our child or school. I said, what you look? We look for curriculum. I said, don't look for curriculum. Look for safety. Okay. Look for happiness of the child, and look like your child is eating, sleeping properly. These two things are very important for a child.
Mm, mm,
So for me, it's very important. I make sure he eat everything like nuts, fruits, and his meal, proper meal, जो भी घर का खाना है, दाल, चावल, there is, he never says no to beetroot also, or
mm,
to karela also. So
mm.
we have to,
Beautiful.
prepare child and train them like that,
Okay.
right? So starting from very beginning,
Yeah.
that's important.
This is amazing. Is there any one exercise or brain tip or any one tip that you want to give before we end? I normally ask people to share So had you been an occupational therapist, I would have asked you to tell me one exercise that is the best. And
For
so you tell
me,
me something according to you. Anything.
for me,
Yeah.
books, books.
Yeah. Okay. Okay.
Because in my home, I have like so many books. Everybody comes there, like, are
Amazing.
you going to make a library? I said, yeah, I am actually thinking. Even if somebody asks me to give old books of Ivan, I said, no, no, no. I want to keep it at my home, make a library. You come and use it or take it
Mm,
on rental basis or just like that. But I don't want to share his books. Rest
mm,
of the toys I'm very comfortable to give.
mm.
But books are like, I feel it, I don't know, I have some emotional thing with
Amazing.
books.
I think
So
this is the best takeaway for me.